Okay, hey everybody, I'm Joel Lourie and I am here with my good friend and colleague Anderson Bass. Anderson is our Senior Medicare Account Manager. And Anderson, I just want to have a brief conversation with you because a lot of times people just will always ask, what's the real difference between a Medicare Advantage and a Medicare Supplement? And is there a right or wrong choice here? Talk to us about that.
Sure, absolutely. There's no right or wrong decision. A lot of it comes down to preference on budget. With a Medicare Supplement policy, Medicare Supplements are also known as the Medigap. Okay. So if you hear that terminology, it means the same thing. And typically the way it works is you would pay an additional premium to an insurance company, and then you have very little out-of-pocket costs throughout the year.
You pay that premium, you have a little out-of-pocket cost, so the Medicare Supplement is then doing what? It's picking up what Medicare doesn't pay.
That's correct, yes sir.
All right, now, question, does a Medicare Supplement have a network?
It does not have a network. There are no networks nationwide with the Medicare Supplement.
So anybody that accepts Medicare can use their supplement. And does a Medicare Supplement have drug coverage?
It does not. With the Medicare Supplement policy, we then need to add a separate policy, a prescription drug plan to cover medications at the pharmacy.
All right, hold that thought. And let's talk about a Medicare Advantage plan. So a Medicare Supplement you've discussed, a Medigap plan. How does a Medicare Advantage plan work?
Medicare Advantage plans are also known as Part C. Right. So that terminology means the same thing as well. With the Medicare Advantage plan, again, typically you would pay a very little to no premium on a monthly basis, but then you pay co-payments and co-insurance as you use the services.
So if you go to a doctor, you have a fixed copay. If you maybe go into the hospital, you have a per night copay for a certain number of nights. Exactly, right? Do Medicare Advantage plans, do you just keep paying, or is there a limit as to what you can pay?
There is a limit. The plans have a max out of pocket. As you're paying co-payments and the co-insurance throughout the year, it adds up. If you meet the max out of pocket, then you're fully covered the rest of the calendar year.
All right, Anderson, what about drug coverage?
Most Medicare Advantage plans include prescription drug coverage. Okay. You may still have a copayment at the pharmacy, but there's no need for a separate drug plan. It's all included.
All right, so you don't need, in most cases, you don't need to go out and get a separate standalone drug plan.
That's right.
All right, I've heard a lot about dental, vision, gym membership. Could some of these come with a Medicare Advantage plan?
Many of the Medicare Advantage plans include some extra benefits, dental, vision, and hearing, just for being on the policy.
Anderson, what about networks? I know with a Medicare Supplement, you don't have to worry about networks. What about a Medicare Advantage plan?
Medicare Advantage plans, you're subject to somewhat of a network. Okay. We need to make sure that the doctors you see are in network with the policy we choose. There are options called PPO policies, that's Preferred Provider Organization, and you have nationwide coverage with the policy.
Okay, so most of the big companies we work with have very broad networks, and rarely does that become a problem.
That's correct. Yeah.
Good. All right, Anderson Bass, sum it up for us in 15 seconds. MedSup versus MedAdvantage. Highlight the differences.
Medicare Supplement, you pay a premium, very little out-of-pocket costs throughout the year other than the premium, no networks nationwide. We add a separate policy to cover medications. Good. Medicare Advantage, you save your money, you pay co-payments as you need to. We check doctors for networks, and most of the plans include prescription coverage.
You're the man. Thanks for joining us.